A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well being day and night. Voice of Healthcare, along with a supporting partner, Yashoda Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctor, which aims to showcase the diverse interests and passions of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So let's get started with introduction. I welcome Dr. Akhil Kulshreshtha, Senior Consultant Orthopedics, Yashoda Super Speciality Hospital. Welcome, Dr. Akhil.
Thank you, Ritika. And
I wish
it's
you
a
a very
great
happy Doctors' Day.
thank you. Thank you so much. And same to you and all the other doctors and all the fellow citizens of my country. And I'm also very happy and feel privileged to be on this show today to speak my heart out a little bit.
Thank you so much, sir. This means a lot to us. And so, to begin with our conversation, um, aside from medicine, what other hobbies or interests do you have?
Uh, well, frankly speaking, if you ask this question to any doctor, he will be a little perturbed, especially at this juncture of his profession after 32 years of post graduation. Because you can now understand, Ritika, that at this stage, our time does not remain our time. It is the time that we spend with our patients. We spend a little bit of time with our family and a little bit of time for our community. So I will not say that I'm not engaging in any hobbies or interest. I do have that. I'll share with that you. But the thing is that we do not have a stipulated time for pursuing our hobby or interest for that matter. I mean, it's just nicks and corners that we just snatch the time out of our day and try to feel a little happy about doing little things here and there. So you will be a little surprised to know my interest because that's very difficult to be hearing from a orthopedic surgeon. And frankly speaking, I tell you, Ritika, that I am um, pursuing this as my hobby, and it is how to make fruit salads.
Nice. It's good.
So
It's actually
yeah,
very good.
so I'm very deeply into it, and I learned it from my own. I mean, from various platforms, social platforms, YouTube, and I make it a point that any country or any state or any city that I visit, I try to go to the local market there, the vegetable market, the fruit market, and I try to see what different fruits they have to offer. And then I come back and then I research it that how can I make a good fruit serving, good fruit salad from that. So this is how I keep myself busy. And I tell you what, my family and my close friends, they have started now enjoying. So wherever I go to any gathering, they usually look forward that okay, Dr. Akhil might be bringing some fruit delicacies with him.
Yeah,
Apart
so
from
that's a
this,
very
I do follow few research publications which I diligently follow, and I also try to read other light readings that usually have give me a breather from my exceptionally heavy schedules.
Yeah, so that's a very interesting, hobby to make salads, different kind of salads, and to make salads also, it is a part of you taking care of your health. So that will be my take on this. And you have mentioned that you don't have much time. So I have rightly mentioned in the introduction that you take care of us day and night, and you are not left with so much time to do other things. That's a very good interest that you follow, the kind of salads that you make, and you are learning a lot of it. Apart from apart from this hobby, do you indulge in any sports or physical activity also?
Again, as I tell you, that really speaking, because as a orthopedic surgeon, I have to face a lot of emergencies day in and out. And being a senior most surgeon in my hospital, I'm usually at beck and call to all the juniors, and they, even if I do not have to be virtually present at the spot of the emergency, then I am around the clock on my phone, giving advices whenever they are stuck up or they need me. But yes, I about 10 years ago I had this inclination and sort of pushing from my family to indulge in a little bit of sports. Particularly my wife, who says that you are always working, so this will not do as we're aging. So I started playing golf. So now, as a passion, I do play golf. And by the way, I tell you that I had been a very avid basketballer throughout my UG and PG days, undergraduation. In my undergraduation, I had a very good record of playing basketball, being captain of my team also. But now I like golf, and it really gives me solace. And it's a slow game, so I can catch it up most of the time. And I can also indulge in camaraderie at that point, talking about my daily activities and my other activities with my friends who join in to play with me.
Right, and to add on, it's not just a slow game; it's a very peaceful game. Uh, so, so you have, yeah. So just like one person said to me that you can find peace in doing daily activities. So sometimes washing clothes, sometimes washing utensils, you can find you can think a lot of things and you feel very good after doing that. So that kind of a sport, golf is, it's a very peaceful sport. And it's very good to know your personal side, that you have been playing basketball and everything, but now you are into all patient care and taking care of us around the clock, and being a good leader to your juniors, the researchers that are under you, the junior resident, senior resident that are under your watch. So we talked about the personal aspects. So now moving on to the medical aspects as well. So are there any particular medical advancements or technologies that you find intriguing or believe will have a very significant impact on the future of healthcare?
Yeah, that's an excellent question, Ritika. I was very much into this aspect of orthopedics. I'll tell you about my branch, and you will be amazed to know that you might have heard about robotic knee joint and hip joint replacements.
Yes,
So
yes.
now, to tell you what, that this is still being in the forefront of advancements in our particular branch. Still, it now has been overshadowed by another thing which is fast catching up, and that is artificial intelligence. Now we are now there are researchers, there are doctors who are working on this project, in which they are using artificial intelligence of the computer sciences to even fix up the bones or fracture fixation. So this topic is also coming up very fast, and I won't be surprised that in my life, I don't know how much it is, but in my life, I might be able to see some software or some program coming up which tells us exactly how to fix up a fracture. See, the dilemma to a young orthopedic surgeon is that as soon as he sees a patient in emergencies, he then have to first decide whether this fracture, particular type of fracture, is required to be operated, or without operation this can be set right. Now there are already principles laid down to follow this, and to an extent the young doctor can come to a conclusion whether to operate or not to operate. But once he decides that it is this particular fracture is amenable to surgery only, then his dilemma again returns back, that how to operate and what to do about the surgery. So that part is now being slowly and slowly taken up by that artificial intelligence thing, so that it can guide us. We can keep the X-ray on that software. We can feed the data of that X-ray into that software, and from that we can come to a conclusion that this would be probably the best option for him. So as we see that our mobiles are changing day by day, as we see that our other technology is being introduced into most of the things that we do, and there is a rapid upgrade to the technologies that is happening around us. Similarly, I think we must take this into also stride that technology should also apply to all the sectors in healthcare, including surgical and non-surgical management of the patient. It does help. It does help.
Right. So I totally agree with you that now previously open surgeries were there. Then came the era of laparoscopic surgeries, and then after that, now robotics is taking the charge, and the the relation between AI and AI technology and healthcare will create a numerous. Will open numerous gates to diagnosis, plus how to approach the diagnosis, or how to approach with the treatment. That will come a long way, and hopefully in next 10 years we see that change. And oh, we wish so yeah, so we wish that that happens in the next 10 or 15 years. Yes. So, is so this Doctors' Day. Do you what message do would you like to give to your fellow doctors? Not from a professional front, from a personal point. What is your take? What is the message that you would want to give to fellow doctors, or your juniors, the senior resident, the budding doctors that are coming into medicine? So, yeah.
Yeah, that's a good aspect, Ritika, also of. I mean, when I tell you a small preamble to it, that when I was young, we used to, at that time, that was in about 70s, early 70s, that I'm telling you, 1970s, that when we used to go, my father used to take me to a doctor for some little ailments. Then I used to look at the doctor in awe. I mean, doing so much work, handling such patients, advising each patient, and then treating, and then making the patient all right, and the patient also finding so much comfort in his words and his actions. So always I used to think that, okay, I'll be doctor one day. So, but slowly and slowly, I'm now about 32 years experience, and so this experience has not only occurred in my professional field; it has gained me insight in my personal, in my community feeling also. So I have seen that a lot of mistrust have generated between the patient and the doctors recently, and probably there are so many reasons. I don't want to indulge into that, but primary reason being commercial. So what I wish to tell, or I wish to speak my heart out now through your platform, is that the doctor should be honest towards himself, and he should simultaneously be also honest in what he's doing, not only his professional activity but in his total activity. So because I tell you what, that a lot of people look doctor towards as not only as inspiration in professional field, but as an idol in normal life also. So let us keep that flag high, flying high. So I will advise all my colleagues, my juniors, although they are of the same caliber, and I am really, I think that they also are thinking on the same line as what I am thinking. And when I talk to most of them, they do speak like that only. So it is just that let us be simple and let us keep this flag of honesty and this flag of selflessness in front of us, so that we always be really a flag bearer of the society. That is what I can say.
I am in awe of what you just said, that doctors should be honest. They should be committed, and they should be empathetic towards the patient. They should always think about what is best for the patient. That is one thing, and I would like to add that apart from that, patient should also be empathetic towards doctor. It should
That's
not be the other way around. It should be from both the sides, so that they can feel respected, they can feel that patient trusts them and they are taking care of their patients in a very good manner. So that is my take on this, adding what you just have said. Honesty is for everybody, not just the doctors. Yes.
I
Yeah, you
just
want.
want to add one thing, and that is that doctors should take care of their health, their physical health, their mental health, and their family's health also. Because as they tell you in aircraft when you board, that in case of dire emergency, oxygen mask will drop in front of you, but you first wear your mask and then you try to help others. So I
Charity
would,
should start from
yeah,
home.
yeah,
Yes.
so I would say that doctors should take care of themselves also before going to take care of their patients. Thank you so much.
Yes. Thank you so much, Dr.
Thank
Akhil. I think this was a very interesting conversation. And I would like to end this session here. And I would like to thank you and all the doctors who selflessly serve our nation's health. And together, we would like to salute your dedication, your compassion, and your unwavering commitment to our health. So, thank you so much, Dr. Akhil.